The landscape of healthcare is changing as health regions are faced with various hurdles: an aging population, an exodus of healthcare professionals through retirement, and waiting lists for various surgical procedures. While at the center of it all, patient care needs to be administered at the best possible quality for every patient who enters the facility. Here's where a new provincial initiative comes into play. The Cypress Health Region is one of many health authorities embarking on a new approach, known as patient-family-centered care. Trent Regier is the Director of Rural Health and recently traveled to St. Louis with 50 other health professionals from the province to learn more about this international model of healthcare.
Patient-family-centered care means that we are going to take a step back from the traditional model that we work in, and we're going to try to implement something different that's going to allow family members, our residents, patients, clients, depending on where you seek services, to be able to have input into their care and their treatment. Overall, too, we're going to allow them to be part of a system where they can actually guide, develop, and help us roll out what healthcare will look like in our health region. Simple things like currently in the medical model that we work in, if you were an inpatient at our hospital, we would do rounds without you. So we would talk about your medical care and you're not there. So something as simple as doing what we were going to call bedside rounding. So when we talk about your case, you're there with us. Or if you're not able to communicate, then we would have somebody else there.
The Cypress Health Region will have its program plan sent in to the Ministry of Health by March 31st, with hopes of having patient representatives on various committees by the end of February, and an overall goal of having 2 or 3 facilities in the region fully on board by September. The Cypress Health Region hopes to have a 50-50 split of healthcare and board members, with community volunteers working together on the initiative, with a call for local volunteers now open across the Southwest.
There may be people interested in how a building is built, and so we would provide an opportunity for them to be part of that. We know that we have a new build in Maple Creek and potentially one in Leader, and we all hope that we're going to get a new one in Swift Current. So there will be opportunities for people to be able to be part of the planning, the design, the building stage of that. There may be people that are just interested in helping us write our policies, so we'll provide opportunity for that. There may be people that have had loved ones in the care facilities, whether it be in acute care or long-term care, that we're happy with part of their care, but maybe not happy with all of their care. We want them to be able to have an avenue to be able to say, you know what, can we make a difference? Can we do this different? Because if it would have happened for my loved one differently, this would have been the outcome.
Anyone interested in finding out more about the Patient Family Centered Care Volunteer Program can contact Susan Stolson at the Cypress Health Region. Southwest TV News will continue to follow this story as it unfolds.